Hi, my name's Ingrid, and I am the Assistant Director for CarePoint at AltaPoint Health Systems. I oversee the Mental Health Hotline here, which is comprised of crisis services as well as care coordination and trying to get people in for regular services for counseling and psychiatry and case management services. My typical day is basically I come in, I check the census of both hospitals, psychiatric hospitals that we have for children and for adults, to see if we have bed availability and who's in the hospitals and what came in last night and who was admitted. The other thing I do is I oversee the staff that answer the phone lines and take the calls, whether it's a person that's in crisis and feels like they want to hurt themselves or somebody else, or they're calling in an emergency for somebody else, or they're calling for the regular outpatient appointment. They are depressed or they're anxious, they're having trouble coping with daily life, and they want to see a counselor or see a psychiatrist. So I oversee those staff. And I also oversee the people who admit to our hospitals. And when they also are discharged, we set up appointments for follow-up care. And then I also oversee the after-hours crisis folks who take crisis calls at night. And all total, it's about 15 people. And we are open 24/7. So it's not just about what happens during the day, but it also is about what happened last night or in the middle of the night as well. So in general, I supervise and oversee people, but I also train people. So I have some folks that are under me that have bachelor's level, and they all have degrees in psychology or social work, undergraduate degrees. And they answer the phone calls. So I train them on the different resources that are in the community. I train them in how to be empathetic on the phone and how to be patient with somebody who's calling in that's in stress or in crisis and doesn't know exactly what they need. So I also train them on how to ask certain questions and difficult questions. Say if somebody was abused, how do you ask them in a non-threatening way if they've had any trauma in their life. And I also train them on how to and where to put them as far as the appointments that the person should have. We also do a lot of work and training on assessing the types of level of care and the services that somebody may need. Obviously, if somebody is able to function on a day-to-day basis and go to their job, but they are depressed, then they don't necessarily need to go to the hospital. Or if they're suicidal and they've been cutting on themselves and they feel like ending their life, then they would need to go to the hospital. So making those kind of different judgments between levels of care and the types of services. There are times too when we get really difficult calls where somebody's calling, making a threat to hurt themselves or somebody else, and we don't have even enough time to go out there, but we need to call 911. So somebody will instant message me and tell me the situation, and I'll get on the phone and call 911 and tell them the situation. Or when the calls come in, they're routed through a telephone software program that we have, and I can actually get on my phone and connect through the computer to listen to their phone call, and I can instant message them and make suggestions as to what to say, the questions to ask, and make recommendations for any kind of interventions or services and what they need to do. So that's also an option that we do too. There are other situations too where we have somebody who needs to be admitted to a hospital but doesn't want to go. So then I will call our crisis response team that is able to go out to them and assess them and see if they're appropriate for a hospital, or maybe they need just outpatient services as well. And then in this department we also collect a lot of data on how many calls come in to the hotline, how many calls were urgent and emergencies or just routine calls. We also collect data on the hospital, how long somebody stays in the hospital, how soon they're seen after their hospital discharge, how soon somebody can be seen on an outpatient basis. And so we collect all that information and all that data and then report it to the center and all of the directors as well. So in general, I think checking the census on the hospital is obviously very important, getting folks into the hospital, overseeing the people who make the appointments and making sure that those are dealt with appropriately and people get the right resources and the right services for their care, and overseeing any kind of emergency situations that come in. That sort of wraps up my day and sums up what I do. So if you're interested in this type of job, I would definitely think about your education and your experience. I came into this position with about 15 years worth of clinical experience, and I have a master's as well as and licensure and certification. So, but to get to those things, you need to start off with an undergrad degree in, say, psychology or social work or something related in that field. And then you'll need to get a master's in, again, psychology, counseling, human development counseling, those kind of related fields as well. And make sure that you do an internship or a practicum as well. And if whatever state you're living in, you want to check the licensure laws in that state to see how many graduate school course hours you need. For instance, I graduated with 48 hours, but I needed 54 hours to get my license, and so I had to go back to school and take a couple of extra classes. So if you can double up on your internship or practicum hours, that's a good way to do it, or just take some extra classes once you graduate as well. And then once you get your master's, you'll need, obviously you'll have had that internship or practicum experience. And I would not expect to make a lot of money in this business because it's just not a big money maker unless you become the director of a big center or something like that. But I would pursue a licensure in the state that you're living in and certification as well. So the certification comes through the National Board of Certified Examiners, and a lot of times you have to take that test in order to get your license. And then once you have your license, that opens you up to a lot more experience and a lot more job opportunities as well. So I think the best and the worst part of this job are sort of the same thing. The best part is that it's a fast-moving business and it's very exciting. There's never one day that's exactly the same because you're dealing with human nature and people who are going through hard times and need help, and it's not a mechanical type of job. The bad side of the job also is that it is fast-paced, so you have to be able to deal with stress because of standards and the way certain states move. The procedures and the processes and the rules change so quickly that you have to be very flexible as well. So if you're a very rigid person, this is not the job for you because you have to be pretty flexible and accommodating to changes that happen pretty frequently. The other, I think, bad side of my job is that the after hours folks, when somebody resigns, it's really hard to find somebody that wants to work late hours, say an 4 p.m. to midnight shift or on weekends. It takes a special person to do that. The best part of my job, I think, is knowing that I am helping people and we're getting people to the right services that they need and giving them that, giving them help. A lot of times people call and they don't know what they need, but they know that they're miserable and they're unhappy. And so we try to help them find their way through the services and help make recommendations as far as the types of services that they need. And we sort of set the bar for what they can expect when they actually do see the therapist or the doctor. And so my hope is that we're kind, we're empathetic, and that we sort of set the stage for what they're going to get face-to-face with a therapist or counselor and a psychiatrist as well. So I think if I would have any advice for you, I would suggest, like I mentioned, definitely do an internship or a practicum with your master's. The second thing is volunteer if you can in a social service capacity, any type of hotlines, maybe at a soup kitchen or at a shelter, any type of experience or volunteering that you can do to get you that counseling experience, where if you're not necessarily counseling per se, you're at least working face to face, doing direct care with people and offering that support and resources as well. The third thing I think I would definitely recommend is a lot of people who come out of master's degrees or graduate degrees have this idea of private practice and that's what they're going to do and they're going to be really, really rich and make it big and so forth. But what they don't realize is that in order to do private practice, unless you're going to take self-pay and somebody's going to pay out of pocket $100, $200 for your services, you have to get credentialed and credentialed and with an insurance company that will agree to reimburse you for the services. So you have to do that. You also have the overhead of an office. You have to pay for your health insurance. You have to pay for your disability insurance. Nobody pays for your vacation days because if you don't work, you're not going to get paid. And if somebody doesn't show, you're not going to get paid. So there's a lot of things that you have to sort of figure out if you're going to take that step and go into private practice. It's going to take money and it's going to take a lot of time and a lot of resources and investment. So, and if you are going to go into private practice, you also have to get your own supervision. And you certainly don't want to be on your own without that kind of support in a supervisor or somebody that you can bounce ideas off of or situations. So I think that would be my advice for you if you want to get into this field.